Okay, hello everybody. I hope you're doing well today. Welcome to the School and Childcare Immunization Requirements webinar for March 3rd, 2026. I can't believe it's March already. It's pretty crazy. This webinar is hosted by the Department of Health. I'm Phil Bulchus, the School and Childcare Immunization Health Educator at DOH, and I will be facilitating today. Okay, so before we get started, I want to cover the guidelines we set for each of our webinars. We do mute everybody during the webinar. If you have questions, you can ask them in the Q&A box of the Zoom overlay panel. We'll answer questions relevant to this webinar at the end. We are offering continuing education today for nurses and medical assistants. Obviously, you got to watch the webinar or the recording. And if you're watching as a group, make sure to individually register for the webinar and complete the evaluation by yourself. You can find more information on our immunization training webpage. To get to our immunization training webpage, you can use the link we have listed above, or you can hop on our doh.wa.gov website and search for immunization training. You can find this webinar and the slide deck linked on this page. There are other continuing education opportunities as well, if that is something that interests you. This webinar has been approved for 1 credit hour of continuing education for nurses by Dr. Xiao Reindahl, who is an approved provider by the California Board of Registered Nursing. Additionally, we are offering medical assistant credit, which has been approved by the American Association of Medical Assistants. We'll talk about the specifics to getting your CE credit using the train.org platform at the end of the webinar. As part of our continuing education approval process, it is required we inform you about any conflicts of interest. And no planners or speakers of this activity have financial relationships with any commercial interests pertaining to this activity. Bit of a mouthful. So in this webinar, we're going to cover some topics specifically for school staff. We're going to cover immunization requirements for the upcoming 2026-2027 school year. We'll cover the use of the Certificate of Immunization and Certificate of Exemption. We'll go over the measles vaccination requirement for staff, which we think is important to highlight again, given obviously the current measles outbreaks happening, in our state and in the nation. And last, we'll cover some helpful resources that school and childcare staff can use to make immunization requirements easier to handle. So today's presenter is Catherine Graff. Catherine is our school and childcare immunization nurse consultant in the Office of Immunization at the Washington State Department of Health. I've worked with Catherine for many years now, and she has always been a wonderful and helpful resource and colleague. So with that, I'm going to turn it over to Catherine to start the presentation.
Thank you, Phil. And hello, everybody. Before I get started, I wanted to let you know that I am retiring as my position here as the School and Child Care Immunization Nurse Consultant. This will be my last webinar. And so I just wanted to say that I have so much enjoyed being in this position, the time that I've been here, and being able to be a resource for all of you. And I'm also really, really happy to tell you that we've hired a wonderful nurse to be the new ski nurse consultant. And her name is Carla Rimmer, who will be our ski nurse consultant. She comes to us with a wealth of experience and school nursing experience too, most recently as the health services coordinator at the Bellevue School District. So please say hello to Carla and give her a big welcome. She's sitting in with the webinar for me as she's learning about her new role. Thanks, Carla. Okay, so let's move on. I'm going to turn off my camera just for bandwidth during this part. And so you'll hear my voice and I'll come on camera again later for the Q&A. Okay, In today's webinar, like Phil said, we will cover the school immunization requirements and the updated charts. There's a reminder about the guidance for children who are 4 years old and special situations. Talk about the CIS and the exemption forms and share information about the measles requirement for staff. And then I'll go over resources, including the new Ski Wizard. And then hand it over to Phil to talk to you about your CE credit, and we'll have time for questions at the end. Okay, so let's start with immunization laws and rules. The Washington State Legislature passes legislation which is signed into law by the governor. The immunization law gives the Washington State Board of Health the authority to determine the immunization rules, including which diseases children must have documentation of full immunity against and what kind of documentation is needed. The Department of Health has web pages with links to the RCW and all of the applicable WACs. You can access them from the main School and Child Care webpage linked here. Now, this page is a one-stop site for everything related to the school and child care immunization requirements. It's a good page to bookmark, so you'll always have access to the most up-to-date information and forms. The law requires documentation of immunity to the diseases identified by the State Board of Health. The WAC lists the diseases for which immunity is required, and WAC 040 says the child must be vaccinated or provide documentation of immunity against each vaccine-preventable disease at the ages and intervals, according to the 2024 CDC Child and Adolescent Immunization Recommended Schedule. Any changes to the schedule after the 2024 schedule was published do not impact the Washington school or child care immunization requirements. This is the 2024 CDC recommended schedule with a link to the PDF. Now, this 24 CDC schedule recommends vaccines to protect against the diseases listed on the left. Next slide, Phil. There we go. Listed on the left. But our state requires children in school and child care to have documented immunity against the diseases shown on the right. The Washington State Department of Health is responsible for creating the vaccine requirements charts for the vaccines that are needed to document full immunity according to the 2024 recommended schedule. Next slide. This is the vaccine requirements chart for children in childcare. The requirements change based on the age of the child. If a child is in childcare is also attending school, they need to meet the requirements on the school chart for the grade they are attending. We recently made some small formatting and link changes on the childcare charts, but there have been no changes to the childcare requirements since 2021. Next slide. There. Okay. And then this is the school chart. The requirements are based on the grade the child is attending. The back of both charts have the rules for the minimum ages and intervals of the vaccination doses that must be followed for the doses to be valid in the series. Next slide. There we go. Okay, since we don't anticipate any upcoming changes to the requirement charts, they have been updated to remove the school year. To make sure you are referring to the most current chart, compare the publication date on the footer of the chart, okay, to the next slide, to the revision date that's on the school and child care immunization page. Again, this is a good page to bookmark. And as you can see, the charts are available in English and 17 additional languages. We recently updated some of our translations. And so if you have any feedback about the translations, please do send that in to us at our email, which we'll share with you later. Okay, next slide. Now, I just want to remind you about the rules for students who are 4 years old on September 1st of the school year. The footnote number 2 on the chart says that preschool students who are less than 4 years old on September 1st that turn 4 after September 1st do not need to provide documentation of the additional doses until the following school year. Now, please be aware that some student information systems may show these vaccines as required when the student turns 4. Schools that are using the IIS school module should use the compliance series preschool age 19 months through 3 years on September 1st when evaluating these students' immunizations. Next slide. And next slide. Okay. Footnote 3 on the chart says they must have the additional DTaP, IPV, MMR, and varicella vaccine by the first day of school or within 30 days after the 4th birthday, whichever is later. This allows students with late summer birthdays to have 30 days from their 4th birthday to get the additional vaccine doses and turn documentation into the school. For example, if a student turns 4 on August 15th, they will have until September 14th to get the extra doses and turn in documentation. If their birthday is more than 30 days before the first day of school, they must turn in documentation of the doses before starting school, since it has been more than 30 days since they turned 4. And I want to highlight that this should not be interpreted to mean that all students have a 30-day grace period from the start of school. Next slide. A comprehensive resource for the requirements is the Individual Vaccine Requirements Summary, or IVERS, which can be found on the School and Child Care Immunization website. It details the minimum ages and intervals for the different vaccines, as well as the exceptions to the rules and catch-up schedules. We revise it every school year or as things change. I highly recommend that you refer to this document if you have questions about the immunization schedules that must be followed for children to be in compliance with the Washington requirements. Now, let's go back, Phil. Now a reminder about students in special situations. Students who meet the definition of homeless under the federal McKinney-Vento Act or children who are in foster care must be immediately enrolled and allowed to attend, even if missing immunization documentation. Students missing documentation are considered out of compliance, but cannot be excluded. Note the student is not considered exempt in this situation. The district's homeless liaison should work with the family to obtain missing records or assist the students with getting the needed vaccinations. Please be aware that students who have refugee or asylum status may or may not meet the definition of homeless. Review these students on a case-by-case basis. You can find the definitions of homeless on the McKinney-Vento website linked here and in the immunization manual. Next slide. Now let's talk about the Certificate of Immunization Status Form, or CIS. Before a child may attend school or child care center, a parent must provide proof of the required immunizations or immunity using a department-approved Certificate of Immunization, or CIS form. The CIS form is created by the Department of Health. It should not be recreated in a provider's electronic health record system. Next slide. There are 3 acceptable versions of the CIS. The validated CIS, which is printed from the Immunization Information System, or IIS. The CIS printed from MyIR, which is a place where parents can sign up to see their children's immunizations documented in the IIS. And a hard copy CIS with handwritten immunization dates. If the hard copy CIS is used, it must be verified for accuracy by a healthcare provider or must have medical vaccination records attached so school or child care staff can verify the accuracy of the vaccination dates. Next slide. This is the validated CIS printed from the IIS. It says complete, conditional, or not complete for the series selected. Because the vaccinations needed change as the children get older, it is very important to correct to select the correct series for the child's age in childcare or grade in school when printing a CIS. Next slide. The CIS shows the date when it was printed and validated by the IIS. No provider or parent validation signature is needed. Next slide. On the left is a place for the parent or guardian to give permission to add information to the IIS. This signature is needed if the school or childcare is using the IIS School and Childcare Immunization Module and the immunization information in the IIS is incomplete. This signature is optional. Next. On the right is a place for the parent or guardian to acknowledge their child will be attending school or childcare with a temporary conditional status. This signature is required if the child will be attending in conditional status. Children who have not completed the vaccinations required for school or childcare can attend as long as certain conditions and timelines are met. Next. For a child catching up on their vaccinations to attend school or childcare, they must have all of the vaccine doses they are eligible to receive and not be currently due for any of the additional doses. While waiting for the next dose to come due, they can attend school or childcare in temporary conditional status. Once the dose comes due, they must turn in documentation of the dose within 30 days. More detailed information, including a catch-up schedule, an overview video, FAQs, and sample parent letter, are available on the School and Childcare Immunization page. Now back to the validated CIS. If a provider has entered laboratory evidence of immunity by blood antibody titer marked permanent in the IIS, the CIS will print the word immune in the positive titer column. This is considered provider verification of immunity and no other documentation is required. Next, okay. If history of chickenpox disease has been entered into the IIS, the box on the varicella line will be checked. This is considered provider verification of history of disease. No other documentation is required. Next. The validated CIS has a page 2 action report. There are 3 boxes on the report: required vaccines, recommended vaccines, and invalid vaccines. If the child is missing required vaccinations for the grade or age in the compliance series selected, they will be listed in the red chart with the date in the dose due on or after column. If the due date is in the past, then the child must have all of the doses due now to attend school or childcare. If the due date is a future date, the child will be in conditional status for that immunization requirement. The child must get the vaccine in the 30 days after the due date is reached. Vaccinations that are recommended but not required for the grade or age in the compliance series selected will be listed in the black chart with a date in the dose due on or after column. These doses are recommended in the national schedule but not required to attend school or childcare. And finally, invalid doses, with the reason they are invalid, will be in the orange box. Doses may be invalid for several reasons. For example, if a dose was given at the wrong age or too soon after a previous dose. When a dose is invalid, it does not print on the validated CIS, and it is not used in calculating vaccine series completion. The action report lists the invalid doses to let the user know why these doses are missing on the CIS. If additional doses are needed to complete the series, the action report will list the vaccine in the required or recommended boxes. If the vaccine is not listed in the required or recommended boxes, then another dose of vaccine is not needed. Now let's talk about the MyIR mobile version of CIS. MyIR is a place where parents can manage their family's immunization records online. Parents can register to use MyIR to view their own or their children's records and print a CIS. Like the CIS, the MyIR CIS prints the immunization dates from the IIS. And there's more information here on the link on the slide on how to sign up. Next slide, there. This is the validated CIS printed from MyIR. It's similar to the validated CIS printed from the IIS. It says it was validated by MyIR, and since the vaccination information comes from the IIS, no validation signature is needed. So unlike the validated CIS, the MyIR version does not include immunity by antibody titer, and it may or may not include history of chickenpox disease, depending on how it was entered into the IIS. Like the validated CIS, it has a page 2 action report with the 3 boxes for required, recommended, and invalid vaccines. Okay, now let's talk about the hard copy CIS. Parents may fill out a hard copy CIS with their child's vaccination dates. It can be used for any child, but children coming from out of state have this version of the CIS most often. Because this hard copy CIS does not use records from the IIS, it must be medically verified for accuracy. This is done with a signature certifying that the information is accurate at the bottom of the page. It can be signed by a healthcare provider who is licensed, certified, or registered in a profession listed in this RCW if administering vaccinations is within the profession's scope of practice. If signed by a healthcare provider, no medical immunization records need to be attached to the CIS. Or it can be signed by a school nurse, administrator, childcare health consultant, or their designee. Before signing, they must determine the information on the CIS is accurate after comparing it with attached medical vaccination records. If not signed by a healthcare provider, the CIS must have medical vaccination records attached. So what is considered to be a medical vaccination record? Examples of acceptable records include provider records, a lifetime immunization record completed by a provider, a record from another state's immunization registry. You can look up state's registry information with the links shown here. And there are more examples in the document, acceptable versions of a CIS. There's a gray box on the CIS where healthcare providers can document history of varicella disease. This is considered provider verification of history of disease. No other documentation is required. Healthcare providers can also use this section to document laboratory evidence of immunity by blood antibody titer. This is considered provider verification of immunity. No other documentation is required. Note, antibody titer is not acceptable for pneumococcal disease or pertussis. And polio can only be documented as immune by antibody titer if they are immune to all 3 polioviruses. Testing for immunity to poliovirus type 2 has not been available since 2016, when the vaccine antigen for type 2 was removed from the oral polio vaccine, OPV, used in other countries. OPV doses administered on or after April 1st, 2016 do not protect against poliovirus type 2, so they cannot be used in series completion. The hard copy CIS has the same 2 places for parent signatures as the validated CIS. And the back of the hard copy CIS includes instructions on how to complete the form, examples of medical immunization records, and information about conditional status. Additional information and resources can be found in the CIS section of the School and Child Care Immunization page, including the CIS form and translations, a video, FAQs, and more. Now let's talk about exemptions to the immunization requirements and the Certificate of Exemption form, also known as the COE. A child can be exempted from one or more of the immunization requirements. To do this, a properly completed and signed COE must be turned into the school or childcare. The COA form is created by the Department of Health. Exemption forms or letters from other states are not acceptable. There are 4 types of exemptions allowed for the immunization requirements. Personal or philosophical, which is not allowed for the measles, mumps, and rubella requirements. Religious, religious membership, and medical. This is a screenshot of the 2 sides of the COE form. Personal, philosophical, and religious exemptions are on one side, and medical exemptions are on the other. Personal, philosophical, and religious exemptions must have the signature of a healthcare practitioner, which is defined as a medical doctor, a doctor of osteopathy, a doctor of naturopathic medicine, a physician assistant, or an advanced registered nurse practitioner licensed in Washington State. The signature affirms that they have provided the signature with information about the benefits and risks of immunization to the child. It is important to note that clinicians and school staff have no role in assessing the validity of parents' or guardians' personal or religious beliefs. This is the section to be completed if a parent has personal philosophical objection to vaccination or vaccination is against their religious beliefs. This section should be used for parent-requested exemptions or alternate schedules. It needs both a parent or guardian and healthcare practitioner signature. Again, there is no requirement for a parent to validate or prove their personal or religious beliefs. We do have a new sentence that's been added to the healthcare practitioner signature that says, "My signature does not necessarily mean I endorse this decision." Next slide. Instead of the healthcare practitioner's signature on the CIE, the education requirement can also be met with a letter from a healthcare practitioner, which is attached to the parent-signed COE. The letter must include the child's name and birth date, state that they have provided the information to the parents about the benefits of risks of vaccination, be signed, including credentials, and dated by the healthcare practitioner. Some practitioners are more comfortable with this option than signing the COE. And here I want to highlight the difference between religious and religious membership exemptions, as it's something we often get questions about. The religious exemption is used when the parent or guardian has a religious belief that is contrary to the required immunization, but the child receives other health care from a healthcare practitioner. It requires a parent signature and a healthcare practitioner signature or letter. The religious membership is used when the parent or guardian affirms that they are membership in a church or religious body that does not allow their child to get medical treatment by a healthcare practitioner. The child does not receive any health care from a healthcare practitioner. It requires parent signature, but does not require the healthcare practitioner's signature. Now, if parents have a religious objection to vaccinations, they can use either, but both types should not be filled out on a COE. Which one to use depends on if the child sees a healthcare practitioner for things other than vaccinations. If they do, then they should use the religious exemption, not the religious membership exemption. The last type of exemption is the medical exemption. They are granted by a healthcare practitioner when, in their judgment, the vaccine is not advisable for the child, provided that when it is determined that this particular vaccine is no longer contraindicated, the child will be required to have the vaccine. Guidance about contraindications to vaccinations can be found in the CDC Child and Adolescent Immunization Schedule and the vaccine package insert. Medical exemptions can be permanent or temporary, depending on the child's medical condition. Both require a healthcare practitioner and parent or guardian signatures. Temporary exemptions must have an expiration date. School or childcare staff should make note of the date that a temporary exemption expires. When the temporary exemption ends, the child has 30 days to get the missing immunization or another exemption. Here are some things to keep in mind about exemptions. A completed COE can be used for the whole student's K-12 school attendance. Only temporary medical exemptions expire. The most recent version of the form should be used for all new exemptions, but students with existing exemptions do not need to resubmit a new CIE when the form is revised. If a COE is incomplete or improperly filled out, it should be returned to the parent or healthcare practitioner to complete accurately. And if the exemption is no longer needed because the student has received vaccinations to complete the vaccine series, remove the exemption from your tracking system. Additional information and resources can be found in the exemption section of the School and Child Care page. The exemption quick reference guide and instructions is a helpful companion to the COE. If a parent is requesting an exemption, I suggest sharing the instructions along with the COE. There are translations, a video, more FAQs, and a toolkit for providers, which includes information about the letter option. Now I want to talk a bit about the measles immunity requirement for childcare staff and volunteers. Employees and volunteers who supervise children in childcares and ECAP or Head Start preschools, including ones that are on a K-12 school campus, are required to have one of the following: proof of MMR vaccination, measles immunity, which can be with laboratory titer testing or by being born before 1957, or documentation from a healthcare practitioner that the MMR vaccine is not advisable for the person. The law does not permit religious or personal exemptions for employees or volunteers. This law applies to anyone who supervises these children and may include teachers, bus drivers, playground supervisors, etc. More information about the law is in the FAQ section of the Child and Child Care Immunization page. Okay, I want to talk to you now about a fairly new resource called the Ski Wizard. It is a tool where you can get answers to many common questions. Use the wizard to look up information about current bugs or issues, how to complete tasks, details about the immunization schedules, etc. You can ask a question and even upload a record to us securely to take a look at. You can use the record to upload a roster file for the school module, manage delegation of vaccine entry, and update contact information for reporting or for the school module, and even tell us about a problem or make a suggestion. We really encourage you to give it a try. And here's just some information you can get. At the top of the landing page includes current information and hot topics. We can update this in real time, so be sure to take a look at the top because there might be some pertinent information there for you. Here is an example of telling us about a vaccine that was entered incorrectly and the provider is unwilling or unable to correct the dose in the IIS. You can securely upload a vaccination record in the wizard that we can take a look at. Here is an example of information about the recent polio conversions. And you can even look up in real-time information about current bug logic errors in the CIS or school module reports. Just select View Information about current bugs or issues, and then select the topic you're interested in. Now let's talk about some other resources. Here are the short URL links for the school and the School and Child Care Immunization page and the school module website. If you have questions, again, check out the Ski Wizard to get information or ask us a question. We have a family-centered school and child care immunization page that we encourage you to share with families as you're sharing information about the requirements. The page is focused on helping families understand the requirements, and includes all the forms and supporting documents they need. We have a full page of translations on this page in Russian, Spanish, and Vietnamese, and all the charts and forms are available in 18 different languages. Now, MyIR that I talked about earlier allows families to view their children's immunization records and print a CIS. Here are some links where you can order or print bilingual promotional flyers and posters that you can use to share information about MyIR. There's been more discussion about helping the public and families understand vaccinations, and many of you may be aware of our plain talk about school immunizations. We've developed some promotional flyers to make it easier to point families to the manual, and we have a version that you can read directly off of our webpage without a PDF viewer. We're also finalizing a new update that will include some visual handouts that would be great to have on hand. Keep an eye out for that in the next month or so. Of course, the individual vaccine requirement summary is a great resource to have on hand, and this is your last reminder that you can find it on the School and Child Care page. And finally, if you haven't already, I recommend signing up for the School or Child Care listserv. We use it to send important information about the requirements, including when updates are made to the charts, forms, or other helpful resources. And I'm handing it back to you, Phil.
Thank you, Catherine. Okay. We do use, well, actually, let's see here. So before I get started in this is a perfect time for those of you watching to ask questions in the Q&A panel if you haven't done so already. And I will quickly cover continuing education again. So as a reminder, this webinar offers nurse continuing education credit, as well as medical assistant continuing education credit, which includes a certificate of completion. To get credit, you'll need to watch the webinar or the recording and complete the evaluation. To do so, we use train.org to host our immunization webinars, and this allows attendees to automatically generate their own certificates after completing the evaluation. You'll need to have an account to access our immunization webinars on train.org. You can register for our webinars, watch the recording, complete an evaluation, and print or download a CE certificate from here as well. Let's see. You'll no longer need to wait for DOH staff to generate and email certificates to you, which is something I think we did as early as last year. If you registered in train.org for this webinar, you will receive an email with a link to the evaluation after this webinar ends. You'll need to log into Train to complete the evaluation if you want to generate a certificate. If you didn't register in Train for this webinar and want continuing education, you will need to create an account, log in, and complete the evaluation. If you do have any questions about the continuing education, you can email Trang-Koos at trang.koos@doh.wa.gov. All right, we made it. Okay, so questions. I have not looked at the question and answer panel, so let me take a look here. You want me to ask them, Catherine, and we can just
Sure, go for it. Yeah, go for it.
Can you explain when to mark immunity by titer as permanent? I've been trained to not mark hepatitis B titers as permanent for children, but then the kids come back to the clinic saying the school won't let them in, even though the CIS printed in clinic states immune in the titer column.
That's a great question, Kara. If the immunity is permanent, it should be marked permanent in the IIS. And hepatitis B, if you've got titers that are showing that they have antibody levels sufficient for immunity, that is a permanent immunity. The same way that other diseases can be marked permanent. Measles, mumps, and rubella, varicella can be marked permanent. Although I have a caveat about measles in a minute here, but so those things should be marked permanent. What shouldn't be marked permanent is the immunity that wanes. We know that pertussis immunity wanes, and actually there is no valid pertussis immunity recognized, so we don't even accept that for the school and childcare requirements. Diphtheria and tetanus, we know we need boosters even as adults to maintain that protection. So those are not permanent immunities either. So you have to be thinking about which are permanent and which are not. Now, just to circle back to what I was saying about measles, mumps, and rubella. There is a webinar coming up from our IAS training team that's going to be talking about documenting immunity, especially to measles in the IIS. One of the issues that we are having with the IIS right now is if immunity to, say, measles, say they did have a measles titer and it came back that they were immune, if it is marked permanent, it is removing all of MMR from the forecast, which it shouldn't be doing unless there's immunity also to mumps and rubella. So when looking at entering immunity for, say, measles or one component of the MMR vaccine, we really don't want to mark that permanent unless it is immune to all three, measles, mumps, and rubella, until we get that fixed in the IIS. So that's my answer. We can move on, Phil.
Okay. Hepatitis B question. In the beginning, you indicated that there have been no changes to requirements for childcare immunizations since 2021, but the hepatitis B requirement has changed, or is that an error?
Okay. There are changes happening at the federal level with the CDC recommended schedule and the committee that helps make those recommendations to CDC. As I said in the beginning, our recommendations are based on the 2024 recommended schedule. So the changes that happened recently to the hepatitis B birth dose in the national schedule have no impact to the Washington requirements because that happened after the 2024 schedule was published. Those are the rules that we are following for our Washington school and childcare requirements.
Okay. Just type in an answer.
Mm-hmm.
Okay, let's see here. Let me know if this doesn't make sense, Catherine. But for the MyIR CIS, is there another way to verify immunity by titer or history of varicella using that platform?
It's not going to be in MyIR, but you can definitely look that child up in the IIS, where you'll be able to see if there's a history of disease documented there or immunity documented there. And if so, you could make a handwritten note on the CIS, just indicating that you verified their immunity in the IIS and just, sign and date it like you would any note. You can do that, or you can just print the validated CIS from the IIS.
Let's see, another question about the federal changes. So is there a plan to transition from following the CDC's 2024 childhood and adolescent immunization schedule to the American Academy of Pediatrics 2026 child and adolescent immunization schedule?
The short answer is no. There's no plans for that at this time. The AAP's current 2026 schedule and the 2024 CDC schedule are congruent. There's not really much in the way of differences there, with the exception of COVID, which is not a required vaccine for school and child care attendance. So not at this time. It may be something that's addressed in the future. It would be something the State Board of Health would have to do and would have to open up rulemaking and change the WAC to do so. So it wouldn't be something that happened overnight.
Okay. I think that's all the questions.
There's actually more at the top, Phil. If you could go
Okay,
up
okay.
to the top.
Oh, new post. Let's see. I understand that we can't question exemptions, but how would you address a parent filling out a religious membership exemption form because they can't get into their doctor for quite some time and get one completed? Or if a student ends up getting a physical to play sports but has a religious membership exemption?
Those are tough. Those are tough. I think I would start with explaining to the parent what they're signing. They're signing saying that they do not get medical treatment for their child from a healthcare practitioner. And they're signing a legal document when they sign that. So I think helping the parent understand exactly what they are signing is important. And then I think you have to rely on your internal for schools and childcare, your policy and procedures on how you handle that situation as a school district or a child care provider or a private school. Um, it's it's a situation where maybe the parent is not being truthful, and then how would you handle that for other enrollment records? I think you need to think of this as an enrollment record, the same as they do for proof of where they live and age and other things that are required when they're enrolling in school or childcare.
MMR staff question here. As a school nurse, my MMR was a long time ago. Any recommendations to repeat MMR for staff?
No, MMR gives 93% as effective after one dose and then 97% effectiveness after two doses. For most adults, they're only recommended to have one dose of MMR vaccine, but with certain populations and healthcare providers, so as a school nurse, you would have been recommended to have two doses of MMR. That does provide lifelong immunity, so that is what you would be recommended to have. If you have your two doses, you're fine. The only caveat to that is there was an MMR vaccine that was out for about 5 years, starting in 1963, that was less effective. And so there are sometimes recommendations that talk to your healthcare provider about whether an additional MMR dose should be given if it's possible that maybe you got this less effective MMR vaccine as a child during those years. So that's the only caveat on that. I will say this too, as far as the MMR for staff. In an outbreak situation, even though adult staff that aren't healthcare providers or some other high-risk groups are only recommended normally to have one dose of MMR, in an outbreak scenario, the local health officer could require that adults like teachers, et cetera, get a second MMR if they haven't had the second one. It would be up to the individual local health officer who is managing that outbreak situation.
Okay. I think Trang answered the other question. Let's see.
I see one from Laura.
Okay.
Where
Go for it.
do I find the vaccine requirements for 2025? I'm on the DOH website and see the latest says 2021. December 2021 are the childcare charts. But if you're on the school and childcare immunization page, you should be seeing that the charts were just updated. And so it has an update date for in the school requirement charts of December 2025. If you open the chart, like the vaccines required for school clinical chart, for example, you will see that it doesn't have a school year on it, but it says revised December 2025. So like I said earlier in the webinar, we removed the date because we are not anticipating any changes. Now that we've completed the roll-up of some of the TDAP rules that we were undergoing for the last few years, and we're not anticipating any changes, and we're pointed to the 2024 schedule. It's just going to be there. So the December 2025 for the school charts is the most current version to use going forward for different school years. And it says new posts. Okay, let me see. I don't know that I'm seeing any more questions.
I'm not seeing any others. Last chance to ask questions. Otherwise, we might just finish a little early. Can you believe it?
That's a rare thing. So while we're waiting to see if there's any other questions that pop in, again, I really would encourage people to use the Ski Wizard. Just play around in it. Try different prompts, see what it gets you, see where it takes you. There really is some great information. There's also information in there on why doses are marked invalid sometimes in the IIS, something that we get frequent questions about here at DOH. So there's some definitely recurring themes in the invalid vaccinations and understanding that. So you can find out some of those most frequent ones and in the Ski Wizard too. So there's some good information in there.
Okay. Well, no more questions that I'm seeing. I guess we can wrap up. Of course, special thanks to Catherine for it being her last webinar. We have appreciated her expertise over the years, and we will miss you for sure.
Thank you. Thank you. Like I said, it's been a pleasure for being here to be a resource for you. And I know Carla is going to be an excellent resource for you going forward. Thank you guys for taking the time to come and attend the webinar and learn about the requirements. Reach out to us. If you have questions, you can do that through the wizard. And I hope you all have a great rest of your day.
Thanks, everybody.